Welcome back here to the Make-A-Wish Radiothon at the Stollot Events Center at the Eastern Hills Mall. 97 Rock live behind us, and we're live here. I've been excited for this interview for a bit because we talk a lot about the fun and enjoyment of wishes, but now we can kind of get the medical perspective, which is also very important here.
We know how these wishes can help with diagnosis and treatment throughout the process. Dr. Matthew Barth with Roswell and Oishei Children's Hospital joining us this morning, a hematologist and oncologist. Talk to us about your role within Roswell and Oishei Children's Hospital, Doctor.
So I'm one of a team of physicians. We have, I think, 11 or 12 of us now that manage our cancer and hematology patients. I primarily take care of our brain tumor patients, leukemia, lymphoma. I do some bone marrow transplants, so I kind of take care of a broad spectrum of patients, and really part of a team of physicians, nurse practitioners, nurses that work real hard taking care of these patients.
When you have a child, especially a young child, who is diagnosed with one of those cancers, that is traumatic for the entire family. Make-A-Wish can help with that trauma, and you truly believe that, right?
Oh, absolutely. You know, anytime you have to, break that kind of news to, a child, their parents, their family, that's life-altering, and it's not something that you can, subtly, go into. It's something that is sudden. It really just puts the brakes on their life. Kids are maybe not going to go to school for a long period of time. They may not see their friends as much. They may be in the hospital for prolonged periods of time. The things that we need to do to treat their disease may cause them a lot of pain, discomfort, stress, physically, mentally. It really is life-altering, and it's not even just during their treatment. It's well documented that children that have had cancer have many long-term chronic illnesses, higher rates of chronic illnesses, mental health, physical health issues. So really, it's a life-altering diagnosis, and fortunately, we cure most children with cancer, but then there are those that we don't, and that obviously is, worst case scenario, and in those cases, it's just even more important to try to provide some kind of positive for those patients that are going through that.
So I have to imagine that once they realize that one of their wishes will be granted, it just has to help encourage them to go through treatment and, to stick with it and understand that there's maybe light at the end of their tunnel.
Yeah, it's interesting because some patients take it kind of with a different perspective. Some will do it as a break during treatment, so they may, will be looking for, all right, I've gone through a really hard part of my treatment, so maybe now I do a wish at this point as kind of a respite in the middle of their treatment. Others will just try to get through everything, and then at the end, it's kind of like a big reward at the end of the tunnel for something really exciting that they can do at the end of their treatment. So it's definitely something that they look forward to very much. It's really fun when they hear, oh, well, I can pick anything, think big. You try to really get them to think about something that they, would never maybe do otherwise, and so it's really fun to kind of see them thinking through the process of what do I want to pick with my wish.
Well, we're here so that we can raise donations to make those wishes come true. You just saw the number on your screen. You can also go to wishesrock.com to check out all the items on the silent auction.
If that's not a reason to donate, that medical perspective, I don't know what is. So please keep those donations coming. They've been pretty steady, but we can always use more here as we push toward the end of the Radiothon.